Poverty and its Impact on Women's Health by Cameron Cardone outline. Part 1. Demographics of the health issues affecting women. Poverty plays a major role in women's health, influencing physical, mental, and reproductive well-being. Women experience poverty at higher rates due to lower wages, caregiving responsibilities, and limited access to education and resources. Living in poverty increases women's risk for chronic illness, poor nutrition, and pregnancy complications. We'll research more about chronic illness and poor nutrition. Today, poverty affects more than 1 in 5 children, and it is a reinforcing factor in the accumulation of adverse childhood experiences, ECAs. Part 2. Demographics of countries. Country 1, United States. Country overview. High-income nation with advanced healthcare systems. Significant wealth inequality and gender pay gap. We'll research further. Women's health and poverty in the U.S. Maternal mortality rate higher than other developed nations. Statistic. While wealth and economic prosperity are highly correlated with maternal mortality rates, the U.S. is an outlier with the highest rate of maternal deaths when compared to peer countries. Country 2, South Sudan. Country overview. Low-income country. We'll research further. Limited healthcare infrastructure. Women's health and poverty in South Sudan. Maternal mortality rate. The maternal mortality rate in South Sudan has improved from 3,845 in 2000 to 692 in 2023. Part 3. Cultural similarities and differences among women. Cultural factors in the United States. Individualism and stigma surrounding poverty. Cultural expectations around motherhood. Cultural factors in South Sudan. Early marriage and limited reproductive autonomy. Cultural norms restricting women's healthcare accesses. Similarities across countries, poverty reinforcing health disparities, and differences among cultures. Availability of healthcare infrastructure, degree of cultural acceptance of women seeking care, and the role of education and community support. Part 4. Ethical considerations and action. Individual and community efforts. Health education and advocacy. We'll research more. Government responses. United States Medicaid, SNAP, maternal health initiatives. Beginning in May 2024, the CMS launched IQ technical assistances opportunities focused on 2 of the main drivers of poor maternal health outcomes. South Sudan limited government capacity. We'll research more. WHO, UNICEF, UN Women, Doctors Without Borders. An estimated 90% of women who die in childbirth or from pregnancy-related complications live in low and middle-income countries. Part 5. Summary and conclusions. Key findings. Poverty significantly worsens women's health outcomes. Women face unique biological, social, and economic vulnerabilities. The impact of poverty varies by country but follows similar patterns. Comparable insights. The U.S. and South Sudan differ in resources but share gender-based disparities. Structural inequality is a major driver in both settings. Conclusions. Addressing women's health requires addressing poverty and inequality. Ethical, cultural, informed, and systematic solutions are necessary. Improving women's health improves families, communities, and societies. These are my references /works cited.